coronary angiography is an invasive procedure that is the gold standard diagnostic test for investigating coronary artery disease. It's an invasive procedure that involves us inserting a small plastic tube in the wrist or the groin, using local anesthetic or some mild sedation to relieve discomfort for the patient. We then insert a longer tube to the top of the heart and insert dye into the arteries supplying the heart. Different tubes are used for different arteries, and essentially a camera moves around the body, taking pictures of the arteries with dye in them to see if there are any narrowings or blockages. After we find this narrowing or blockage, we can then decide what to do about it, either on the same sitting, or we can stop and bring the patient back for a procedure after that. So coronary angioplasty is done immediately after an angiogram or in due course at another date. It essentially describes a procedure where, having seen the narrowing with the dye inside the artery, we then proceed to balloon open the narrowing and then insert a metallic mesh called a stent to keep the artery open. This metallic mesh is often coated with special drugs that make sure that the procedure is likely to stay successful for many years to come. And after the procedure, the patients are required to take additional blood thinners to help keep that stent open. Any procedure where you're inserting things into the heart is, of course, a major procedure, but it is relatively straightforward for patients. Often the procedure is done via the wrist or the groin. Local anesthetic is used during this initial needle puncture, and a small plastic tube is inserted either in the wrist or the groin. And during this period, patients can experience some discomfort. If the procedure is quite uncomfortable for them, we can always give them mild sedation to help alleviate some of these symptoms. Ultimately, the procedure isn't risk-free, and so it is a major procedure. However, it often only lasts an hour or sometimes even less, and patients can go home a few hours after that and can resume normal activity within a few days. So all in all, it's a major procedure, but it's not as major as an open heart surgery in any way.